Well, welcome, everybody. Welcome to the first meeting of the Joint Committee on Addiction and Community Safety Response.
In a move that feels long overdue, Oregon state lawmakers formed a special bipartisan group aimed at tackling the addiction crisis. They met for the first time Wednesday afternoon.
We're here today because the current state of the drug crisis in Oregon is unacceptable.
Lawmakers admit this comes after addiction services in Oregon have been underfunded for years as the crisis got worse.
We are grappling with cheap, deadly fentanyl that has hit our streets in the last sort of 3 or 4 years in a big way.
Less than 20 minutes in, technical difficulties brought the meeting to a crashing halt.
This is what happens when you take a little time off, right? Everybody forgets how to operate the machines.
There was a brief recess.
We are going to stand at ease for a moment
before things finally got back to the focus of the meeting.
All right. So,
which was how to increase access to treatment and addiction prevention tactics.
So we should be investing as a state in prevention, actually doing the evaluation to make sure that it's effective. We're never going to, it's impossible to have enough treatment and recovery if we never look at prevention.
They're also working to make sure law enforcement has what they need to keep communities safe, and that includes making changes to Measure 110, the controversial law that decriminalized certain amounts of hard drugs.
And Oregonians want this issue resolved. Oregonians believe that Measure 110 has been a failure. That shows up in every survey and polling that I've seen. And it is incumbent on us as the legislature to address this as the emergency that it is.
The committee co-chair, Democratic Representative Jason Krupp, shared a similar opinion on the measure when we sat down with him earlier in the day.
Do you think Measure 110 is one of the things that is or isn't working right now?
I would say that's a mix. So one example of something that I think is positive is I went and visited one of our juvenile inpatient treatment facilities out in Prineville, and I had a chance to take a tour of that facility and meet with people who work at that facility. Measure $10 have gone to that program to help that program serve young people in crisis. So that's a positive about Measure 110, and I don't want to go backwards when we're funding those types of services. I think there's also things about Measure 110 that aren't working as well, and when we see, and I don't necessarily attribute this all to Measure 110, but when we see open drug use and we read reports of open drug markets, that's not acceptable.
And for many people, addiction and homelessness goes hand in hand. Is there going to be a focus on homelessness within this committee? I mean, many people on the streets tell me personally that they became homeless and then they turned to drugs.
Right. I think that there's going to be work in this, continued work during this short session about how do we make sure we have enough affordable housing and how do we have enough shelter for those folks who are unhoused right now. That I think there is this uniform value that we want to help people who are struggling right now. And it's hard, it's complex. There's going to be a number of different ideas of how we help those folks in crisis, and this committee is set up to sort of vet all those ideas.
And this is, quite a complex problem, and solutions will take some time, but for many areas, including Portland, time is kind of running out on the streets there.
Right. I don't, and I think you'll hear Senator Lieber say this, I don't think this is not just a sort of wave a magic wand and we fix all the problems. So part of this is what are the immediate steps that we can take right now.
The lawmakers heard from about a dozen experts in the addiction field, from the local to the national level. The meeting itself lasted for about 4 hours. Now, typically, these types of meetings last for about half that time. So it's just another example of how lawmakers are now finally prioritizing these types of conversations. Though I will point out, today's meeting felt rudimentary, and perhaps that makes sense. It was the first meeting after all. But lawmakers were asking for basic definitions of what is a detox center and what is the difference between a sobering and a stabilization center. We've been hearing talks of these types of facilities back in the Portland metro area, but it's these seemingly basic conversations and questions that really demonstrate how Oregon is truly at the beginning of finding long-term solutions when it comes to this crisis, and that it will take time that many argue is running out. Now, the next one of these meetings is on November 6th, where they plan to hear from law enforcement officers on what they're seeing on the streets when it comes to drug use. In Salem, Blair Best, KGW News.